So I'm a radiologist by background, and I founded a company called Nucleus Health in San Diego that's in the medical imaging space. We provide both technology solutions and services to now over 400 hospitals nationally. And one of the core things we built is our cloud platform for medical imaging. And that's going to be one of the key enabling technologies that we're going to be using at Mint Health as well. Mint Health is a revolutionary platform leveraging blockchain and a token incentive system to really drive and change patient behavioral to make sure that we can change the exploding costs in the healthcare system today. Because without it, we're going to go broke. That's the truth of it. The costs are exploding in this country alone, from $3 trillion to $5 trillion annually, going to 20% of GDP in just 5 years. Completely unsustainable path, and if we don't do anything about it, we're going to end up with a very sick elderly population that is just draining all of our resources. But the good news is all of that is being driven by a few key things that just require some behavioral change, and that's where, with the proper incentive system, a whole new token economic model, and leveraging blockchain, we can really put a dent in these exploding costs. I think one of the key things is we're looking at it holistically, from attacking what's wrong in healthcare today rather than just individual parts of a large system. And we're getting to the heart of the problem, which is this out of control cost driven by bad behavior. It's just, sedentary lifestyles, diet, lack of exercise, these types of things that are leading to all these chronic conditions. And by just focusing on these behavioral changes, we can actually make a wholesale population health change that's required. So the token for Mint Health is called a VitaMint, V-I-D-A, Mint. Patients are going to earn the tokens, and they're essentially going to mine for these tokens through their own healthy behaviors. As they do prescribed activities through the application, the mobile app, they will earn tokens in real time, providing instant gratification and an incentive for this behavior. And the provider systems and the physicians and other providers are going to be the ones to set which behaviors are worth which amount of tokens, and the patients are going to earn the tokens through that method. Yeah, so one of the great uses for blockchain in healthcare is centered around data liquidity, where we can use Ethereum smart contracts to allow patients to have control over who has access to their data, and also allows them to see a global audit trail of who has access to their data. And so basically what we're doing is creating a self-sovereign personal portable health record that's on a mobile device. We can take data that's in multiple systems, and leveraging the technology we've developed at Nucleus Health and MD Revolution, have that data come into a personal cloud storage account in Microsoft Azure, and then using the Ethereum smart contract, we can write in that contract, the patient can choose, I'd like to give access to Dr. so-and-so or this clinic or this hospital to my records, and that's written in the smart contract. And then when that person logs in to access the records, the smart contract validates that they have permission, and then of course there's a global audit trail on top to show who's accessed the data. And I think that's one of the things that will allow us to create a whole different trust perimeter within the healthcare ecosystem, where patients can easily control who has access to their data. Yeah, and so in healthcare today, we have siloed data because we have very sensitive personal health information contained in systems that are locked up for good reason. This is sensitive information with a lot of security around it, and it's not been very easy to move that data from one system to another, or to give patients access other than burning them CDs or patient portals that may have very limited information. Here, what we're talking about is being able to securely protect this data. It's all encrypted within the storage account at rest, and then using an infrastructure through blockchain that really controls who has access. And we know, and controlling not only has access, but also getting a global view on the audit trail of who's done what to the data, making sure it's in the native form that it was acquired in, et cetera. So let me give you an example of how simple we view this will be through the Mint Health app. So a patient goes in, we'll call her Mary, goes into her primary care doc complaining of shortness of breath. The doctor orders some studies, an echocardiogram, maybe runs some tests. At the end of that visit, it should be as simple as Mary taking out her mobile application, having her QR code scanned, which is her public wallet address for her health records, and having those records transferred to her personal health storage account. Later, when Mary visits, let's say, a specialist because of continued issues, and she goes to a cardiologist, now when she walks into that cardiologist's office, in the future, it should be as simple as scanning that cardiologist QR code, which is his or her public address for being on the network. And once that QR code is scanned, that permission is written to the Ethereum smart contract, and now that cardiologist can log into either the Mint Health portal, or we can have the records transferred directly down into their own electronic health record system. And they can view, let's say, this echocardiogram that was previously done at an outside facility rather than repeating the study. And they're able to now make the correct decision on what to do with Mary, perhaps start a new medication or increase the dosage or whatever it may be. But being able to make a decision with all the information at hand, which is one of the biggest challenges we have today in healthcare, is we're often left just making decisions in a vacuum when patients show up on our doorstep, not having access to any of their data. But imagine a world where literally all you have to do is scan a QR code and you now have access to everything that patient had prior. So the Mint Health app is a great mobile application centered around patient engagement and gamification. We're picturing a lot of cool features just for regular things like being able to communicate with your provider network, with your physicians, being able to book appointments, et cetera. But really the core of it is setting goals for yourself, going through and following through any treatment plan that was prescribed for you, earning tokens along the way, perhaps completing training modules on things like how to manage your diabetes, et cetera. And once again, earning tokens along the way. Having a social component where you can track how your network is also doing and how you're doing against your social network to help motivate and push each other. So we're looking at creating an entire ecosystem around healthy behaviors and lifestyles centered around earning vitamin tokens, making it fun, exciting, engaging, getting patients to come in on a daily basis and really monitoring their health status and doing the right things to move forward, and then having many amazing redemption options with those tokens. You know, one of the most exciting parts about working on this project has actually been just the interactions with others in healthcare, the excitement, the energy, the passion that's coming together on this project. To hear this feedback over and over again that, wow, this is really going to transform healthcare. This is what healthcare needs. This is exactly dead center to the problems that we face. And all the way from whether it's the global healthcare CISO of Microsoft, Hector Rodriguez, and the feedback he gave us on the white paper and now on as a formal advisor, to others deep within healthcare. So we're receiving this daily and it's really energizing the team.